Hello and welcome to a Fireside Chat with VSR. We are going to discuss about digital health and what digital is doing to health. We have a very special guest, VSR, who is a chief digital advisor. He has donned many hats in many prestigious firms including TCS, Infosys and Tech Mahindra and shaped their digital dreams. Currently, he's a digital advisor. He's also chairman and MD of BT and BT. He's chairman Open Digital Innovation WG IET India. He's a speaker, author and a social entrepreneur. Welcome VSR.
Thank you, Sai. Thanks for that introduction.
So today, as we delve into the world of digital and particularly how digital is kind of driving healthcare, we would like to understand what are the challenges that you see in digital or in the healthcare industry.
Yeah, prior to getting into this digitalization or digital healthcare, we need to understand what challenges this country is facing. Okay, first one, we are 18% of the global population.
Right.
But do you know how much we spend on healthcare? It is just 1.2% of the GDP, which is very alarming. Right? And 55% of Indian population don't have access to the basic healthcare facilities, unfortunately.
Right.
And very alarming statistics I want to share with you today is every year around 50 million people getting into poverty because they are not able to spend money on health. Once they get into the health issues, there's a lot of money they have to spend. Right? I think these are all main issues. In addition to that, 25% of the global TB cases are from India. And more the non-communicable diseases are spreading in India to the core because of the lifestyle and all. So that means there's a lot of focus required for India to ensure that the youth and also the other citizens are healthy. I think these challenges needs to be addressed. Digitalization might be one of the instruments.
Right. What about regulatory and policy part of it?
Yeah, I think still the healthcare community feels that the regulatory and policies needs to be relaxed so that more and more I think the healthcare initiatives and innovations can be emerged. So hopefully I think in the coming years when the digitalization comes, so certainly when you have the technology innovations, the supporting policies are required. Right. Let us say if you want to save the electronic health records into the database, then people have to use the blockchain. But do we have the policy for that? I don't think so, right? So that means the regulatory and policy changes are must. They must be aligned with Fifth Industrial Revolution. We cannot live in the era of British, and we must change the policies and regulatory norms.
Right. You rightly put, there needs to be a lot of growth and also there needs to be a lot of policy push and also a lot of innovation that needs to happen and that needs to happen in India. While we are moving in at some pace, like you said, but we are a little, laid back or so particularly speaking of digitalization, what impact do you think it will have on healthcare if you push it through policy, through individual force as well? What is it that you see?
See, for example, we are saying that 55% population don't have access to the basic health care. Then you can have telemedicine or telehealth care, for example, right? So doctors sitting at metro cities or bigger towns and primary health care centers might be there at the villages or remote rural areas. Then through this telehealth care, so a lot of I think services can be offered remotely. That's number one. And number two, today it's not just simply ATMs for money. There are ATMs for medicines. Some of the organizations are working. They're releasing this anytime medicines. It is a machine. You can put it in the remote places and probably some places where you don't have access to that, right? So that you can go and put the card and get the medicines. Okay. So they also doing from that machine again telemedicine. You can connect with the doctors and all. The other innovations are your diagnosis area. Okay, there are so many artificial intelligence machine learning algorithms are there to diagnose this cancer or any other diseases proactively based on the health parameters, right? Today there are 250 body sensors are there which can read the vitals of your human body. So what does it mean? The technology is now injected into the human body. You can have nano robots. So that is in the research stage, but tomorrow those nano robots can go into the human body and it can repair the cancer cells. And even today, the medicines are given with the RFID tag or a sensor, so it also you can monitor what is happening within the body, right? So the digitalization has the ability to introduce 5P healthcare.
Right.
So what does it mean? So one is the predictive.
Right.
Can I predict how my health will be? Right? If I predict, then I can prevent.
Right.
Okay. So those two are the very important things. Then the next one is prescriptive. Once you predict, so if you want to prevent, you also need recommendations. Who will give the recommendations? Doctor? It's not only doctor.
Right.
The artificial intelligence, machine learning algorithms are also able to give the right diagnosis results and also the recommendations. They prescribe what is the best medicine and all. Of course, the doctors have to validate. Still, AI is emerging, right? Then is participative. Healthcare is not just simply doctor is saying, patient is listening.
Right.
The patients have to participate throughout the life cycle. They have to be educated and they should probably discuss with the doctors and all. It is participative. The most important thing is promotive.
Right.
That means the education. Then only people knows that what sort of health issues will be there. Okay, then the proactive, predictive, preventive aspects will come into picture when you educate the people. That is called promotive. All these things are possible only when you have technologies.
Right.
All these 5Ps are possible effectively when you digitalize the whole healthcare ecosystem.
Right. That's a very interesting viewpoint of 5Ps: predictive, prescriptive, preventive. It's really nice how each is interconnected as well. Now, while AI is emerging at one point, and maybe we can see for general healthcare issues, even AI could prescribe medicines. But are we preparing our future generations? Are we preparing our future medical students to cope up with what AI is doing as well? Because AI is an instrument finally, but are we helping them? Are we enabling them? And are we really preparing them for the future?
Today, most of the medical colleges are even struggling to give the basic experience called clinical material. If you have a medical school, then how many patients are coming to that teaching hospital? Okay, that is called clinical material. If I am getting the patients who has the diseases and all, and my students are getting experience in probably diagnosing and curing, that means they are getting the hands-on experience, right? So I think the students have to get better clinical material, but unfortunately it is becoming a challenge in India because you are opening the medical colleges like shops, okay, and the same patient base you have to try, and it is a struggle. That's where a lot of innovations are happening to set up the simulation labs.
Right.
Okay, the simulation labs are designed to provide the virtually all the clinical material required. They can simulate the different diseases, and then the students will come and experience as if there are some mannequins and electronics, computers, artificial intelligence, machine learning and all. So that is one aspect. The second important aspect is the pedagogies have to be changed, and the doctors, the faculty and students have to start using the digital learning platforms. It is like personalization, right, and immersive experiences to ensure today what a faculty cannot explain. If I get into the metaverse type of a world, then the students can experience the human anatomy very well, and that is explained, right? So I think they can use a lot of technologies to learn better, faster and cost effectively. Ultimate goal of the student coming out of the medical college is how faster the student become productive so that he can start the practice. It's not like 2 years, 3 years, I want to do this internship or XYZ and all, right? How to make the students more productive and socially responsible when they come out of the medical school. Leveraging technologies is the future.
Right. What about research? The emphasis on research in India seems to be very abysmal. And what is your view about that? And also certain soft skills. When you go to a doctor, it's not just about a prescription that you're waiting for. You're looking forward to learning what your body is going through and how you can effectively counter that. So one is emphasis on research that, if you can address that, and also the soft skills aspect of it.
Unfortunately, India, the whole research spent probably around 1.5% of the GDP.
Right.
Very alarming. Healthcare, it might be further low. Okay, why Bharat in the past, maybe thousands of years back, the brains were so powerful, we invented so many things, but unfortunately India, we don't have any inventions because the focus on research is very low. Right? I think that has to be improved tremendously. Okay, so that is one important aspect needs to be looked at. The second important aspect is it's not only medical. I mean, in any profession today, what is the personalized experience you provide? And especially in the medical, the doctor is a god. The way the doctor speaks cure 50% of the problem. If the doctor is rude and doctor is not responding to the patient the way it is required, and probably nowadays, unfortunately, some of the doctors also give some threatening messages. Oh, this is the reason, probably something might happen and all, right? I think they have to be good counselors, they have to be good mentors, and they should have the compassion.
Right.
Those doctors will be successful. It's not just only subject matter expertise.
Right. I think we have covered three aspects, but one very important aspect that is emerging, and also I think you mentor many young and budding entrepreneurs as well, and you yourself are an entrepreneur. So what is the role of entrepreneurship in healthcare, and how is it evolving in India?
Yeah, the entrepreneurship is very attractive. I mean, many people wants to get in, but it's not easy game. Working in a corporate versus working in entrepreneurship is like you are moving from a 7-star hotel to a Amirpet type of a roadside buddy shop. I mean, I'm sorry to say that in the beginning.
Right.
Okay, so what is the most important thing in the entrepreneurship is they must have the purpose and passion. Okay, without that, getting into that. The second important thing is they must plan for their cash flows for their family and also for the business. And third, in healthcare, a lot of opportunities are available in the innovation perspective, right? A lot of wearable devices are coming, right? So a lot of medical devices are coming with Internet of Things, artificial intelligence, machine learning and all.
Right.
And you can establish next generation diagnostic centers where we don't want the traditional way of doing all these diagnosis and tests, right? There are so many technologically enabled medical devices are coming. The entrepreneurs can come and start the smart diagnostic centers, right? And they can start the hospitals with less, I think, physical visits and more the technologically enabled, IoT enabled diagnosis and all, sitting at the home for the elderly and also people who are not able to move, how we can provide the remote monitoring and healthcare.
Right.
All these things are opportunities. It's not just only medical devices and drugs.
Right.
Okay, hospitals also can innovate. They can really start with next generation hospitals and provide better healthcare.
Right. I think your viewpoints require each of the points that you have spoken about will require a podcast in itself, because each of the things, if you talk about GDP, if you talk about entrepreneurship, if you talk about the policy and research aspect of it, each of them become topics by themselves and require huge deliberation within themselves. And thank you for throwing light. This is a macro podcast, I would call, and I would look forward to having you more on this space and talking to us more about how we can address each of these aspects and how practically we can solve these, and what are the action points that we can create, or a blueprint that we can create for realizing goals that of 2047 that you speak about. I think healthcare will play a very major role in 2047, the Bharat that you're dreaming of. Thank you, Vyasa, for joining us today, and we look forward to more. Thank you, everyone.
Thank you so much, Sai.
Thanks.